Honourable Speaker, Mr. President, Members of Parliament, honoured guests, and the most important people, fellow South Africans. From our history, it is evident that we are resilient people, able to adjust and survive even in the extreme difficult times and circumstances. However, Mr. President, after your 5-year term of empty promises, you and your ANC government are certainly testing our resilience. From constant load shedding, forever increasing violent crimes, high levels of unemployment, especially the youth, loss of investment due to corruption, poor management, and cadre deployment, all of us, it has ultimately contributed to our critical economic situation. A government's main task is to create an environment for economic growth and opportunities, as well as to provide service delivery through effective policies and legislation, none of which you have been able to achieve in your term. In fact, Mr. President, you have done the exact opposite. If we take only but one example, the NHI Bill, which has just been bulldozed through Parliament with your ANC majority, will actually provide people with less health care, specifically affecting the poorest of the poor. It is clear as day that the NHI Bill is unconstitutional and unimplementable. This has been pointed out not only by the Democratic Alliance, but also by organizations such as Business for South Africa and Business Unity South Africa. Even medical associations such as the South African Medical Association has warned that we will have a complete skill drain of medical practitioners should this bill be implemented. Mr. President, it is clear that the NHI Bill will be the final nail in South Africa's economy and will completely collapse an already underfunded and decimated public health sector. Despite passing this bill, South Africans still do not even know how it will be funded. The only conceivable way would be to increase taxes on an already overtaxed population. One only has to look at the troubles our public healthcare system is facing now to know that this bill is nothing more than a cheap political tool for the ANC to try and save itself from an inevitable losing its majority. Almost all public health facilities are understocked and underfunded, with many not having the necessary equipment to complete life-saving operations. In fact, most public hospitals do not even meet the minimum criteria for certification by the Office of Health Standard Compliance. Some public hospitals do not even have computers or electricity at times, with doctors having to operate with cell phone torches. In some hospitals, patients are pulled up flights of stairs to the operating room because the lifts either don't work from lacking of service or because they have not exempt from load shedding. How can we possibly implement this bill when we have the shining beacons of maladministration and corruption, such as Livingston Hospital in the Eastern Cape, Pilanomi in the Free State, and Rahima Musa in Gauteng? We have a massive shortage of doctors and nurses in the country. Just the other week, we heard how approximately 800 doctors who recently graduated and finished community service are sitting at home without a job because the ANC government cannot fund them. All the while, we pay millions of rands a year for Cuban doctors to come to South Africa. Even your own Minister of Health admitted that there is no funding for these posts. Where are we supposed to fund the NHI from when we can't even put doctors in our hospitals? The budget implications for the NHI Bill are enormous. Again, one of your own, the Minister of Finance, has stated that there is no money to implement NHI. If your own minister has admitted this, then why, Mr. President, are you playing with the people's lives for the sake of cheap politicking? It is time you play open cards with us, or admit that NHI is not financially feasible and put business and medical associations and the people of South Africa at ease. But I can go on. These feedback The feedback received during the public participation processes of the NHI Bill was not carefully considered by neither the National Assembly nor the National Council of Provinces. Public participation is one of the core elements what makes our constitution and lawmaking one of the strongest around the world. Mr. President, the DA wrote to you requesting you to refer the NHI Bill back to Parliament as it will not pass constitutional muster. Both BUSA and BSA have written to you requesting not to sign the bill. You cannot just stick your head in the sand and pretend these very real issues do not exist. It is prescribed in the Constitution that you must refer a bill back to Parliament if there are constitutional concerns. But it looks like you would rather pander to your ANC colleagues than to your constitutional obligations. You have had your chance, but your time is now up, Mr. President. The DA will fight for the achievement of realistic universal health care and will ensure that public facilities are strengthened to improve service delivery and accountability without detrimentally financially burdening our country, as the unconstitutional NHI Bill will do. Under a DA-anchored government, no person will be excluded from accessing quality health care. Under a DA-anchored government, there will be a realization for progressive rights as enshrined in Section 27 of the Constitution.